And tell me what happens from the customer's point of view, that client experience. So they've downloaded the app, they come into your system. What happens from that point onwards?
Yeah, so essentially, and that's a really relevant point, because Cyber Clinic has really been designed as a patient-centric app. And as you know, there are a lot of platforms out there. There are the telehealth platforms, digital platforms, but a lot of those platforms are practitioner-centric. So what you have to do is you've got to sort of plug and play, incorporate them into your sort of clinic, and then be able to go out and get access to patients. Whereas we've kind of flipped that entire model around and focused it back on the patient and the client, and seeing what is their journey, how do they want to access the services, what are their major pain points, and what actually reduces their barriers to get access to coming in. And so very simply, we've got a 3-step process on the platform, which we call match, connect, and measure. And essentially what happens is, once they download the app, clients can then, they get matched. So they answer a set of questions, and we use an algorithm that is designed to then match them to their best fit practitioner. And a lot of the data suggests now that the Therapeutic Alliance is really a key element in being able to retain patients, but also to be able to get better outcomes for patients as well. And so we match them using that algorithm. We then connect them using an inbuilt video conferencing system, which is secure, encrypted. And so we don't use a third-party application like Zoom or WhatsApp or other sort of video conferencing systems. And so that allows us to make sure that the end-to-end connection between the patient and the practitioner is completely secure, but also we're able to make sure that you are actually connecting with the person that you're supposed to be connecting, as opposed to the systems that you now have, where you have a link and you can just send the link out, because that link could be sent to anyone. So it connects them using the inbuilt sort of video conferencing system, and then it measures the progress of the patient. So patients have the ability to then provide feedback in terms of their well-being. That information goes back to the practitioner, and they can use that data clinically to be able to then tweak their sessions so that they actually improve the engagement with their patients. So we've got one component which is really looking at the well-being, and the other component which looks at the therapeutic alliance between the patient and the practitioner. And what we have found through that process is that it actually increases the engagement with practitioners, and keeps the retention rates a lot higher. Stats, sort of universal stats, suggest that almost about 35% of patients drop out after the first session, and almost 65% drop out before the 10th session. Right, so these are all sort of published studies, but what we know is that the Therapeutic Alliance, in fact, will be able to actually keep people in those sessions a lot longer. And through our TAS that we call the Therapeutic Alliance score, we have over 75% of our practitioners have a Therapeutic Alliance score of 84% and above, and so their retention rates are a lot higher on our platform. And if you look at it from a practitioner point of view, that makes a lot of sense for a practitioner. It also improves their sort of day-to-day management of patients, but also reduces their overheads and costs as well, right? Because if you're constantly working with new patients who keep coming in, those costs actually go up if you're not actually retaining them. So that's the other advantage of the platform, the clinical data and the analytics that we get, that we can then provide back to the patient and to the practitioner, which then improves the engagement and outcomes within the therapeutic context, which is really important feature of the app.
And there's a number of things you've done with the algorithm there. You mentioned already, I think, was it the PAS? Was that what you were just referring to there? Practitioner
Alliance score, yeah.
So that is something that you've developed within the context of your own intake onboarding process, the algorithm that supports the extraction, I guess, of eliciting of the information that's coming out of the client, and then applying that as against the the practitioner group that you have within the cyber clinic.
That's right. So the the onboarding process of the patient allows us to get a better match to the practitioner, and then once they've started the therapeutic process, session by session, they're also providing information back to the practitioner about how they're going in the session, which the patients and the practitioners can track, and that allows the practitioner to improve their engagement with the patient. So the analytics, the analytics also provides information to practitioners, and we're in the process of developing a number of these features now, which will allow practitioners to be able to see which groups of patients they most have maybe better engagement with, for example, not only groups in terms of the presentations that come, but also through the different contracts, because we've got a number of contracts with with corporates, with insurance companies, with primary healthcare networks. So the referral stream comes through a number of different sources, and now B2C as well, and so that will allow practitioners to then look at where are they getting maximum engagement, what are the types of engagement, where does the dropout occur, is it through different contracts, is it through different presentations. So it's really quite exciting in terms of what the data analytics can provide in terms of improvement of the not only the patient experience, but also the practitioner's experience of providing therapy through the platform.
So that is so you're referring to the those frameworks around patient-reported outcome measurements and patient-reported experience measurements. Is that a fair sort of interpretation of that?
Yes, it's similar, but we're using clinically validated measures based on the research that we have built. So this is proprietary information, and we've built all of these scales into our system, which then allows us to do the analysis in terms of the data with the back end to be able to give more meaningful aggregate data back to the practitioners and to the patients about their experience through the therapeutic process.